Good afternoon and welcome to this afternoon's community briefing on COVID-19 and our local response. Joining me again is interpreter Francis Beaurivage. Thank you so much for being here, Francis. And thank you as well to the media and all of you who are tuning into these briefings. We want to remind you that our website, covid19.lincoln.ne.gov, is another great source of accurate, timely, and reliable information about the pandemic. We also want to mention that at that site you can access our online dashboard. That data dashboard that has been stood up by the Lincoln and Lancaster County Health Department is updated twice a day, once in the morning and once in the afternoon. Moving on to our situation update. Today in Lincoln, we have had an additional 6 new individuals test positive for COVID-19, in addition to the 10 individuals we reported this morning. That brings today's total to 16. Of the total 156 individuals who have tested positive for COVID-19 so far in our community, 36 of those individuals have been in the last 2 days. The most recent 36 people represent nearly a quarter of the total cases reported locally. As we have stated previously, this jump in confirmed cases of COVID-19 is cause for concern, although it is not unexpected as we experience increased availability of testing in our community. And here to provide more details on the new cases and the health department's investigations of them is Health Director Pat Lopez.
Good afternoon. In Lancaster County, 4 of our Lancaster County residents are hospitalized at this time, and 1 is currently on a ventilator. Nebraska now has 13,136 cases and 56 deaths. And again, 1 of those deaths was here in Lincoln. As the mayor said, the increased testing we have seen through the hospitals and drive-through sites has contributed to the growing number of new cases. The number of tests available from the Public Health Lab and LabCorp is going to go up again from 150 to 300 in Lincoln sometime this week. This increase in testing is crucial to provide us a better idea of the extent we have community spread in Lincoln. The increase in testing has also given us a better understanding of the positivity rate. In late March and early April, testing was not widely available, and only higher priority populations were being tested, such as our first responders, our healthcare workers, and nursing home workers or individuals in a nursing home. The positivity rate at that time held steady between 2 and 3%. Now that the testing is more available and more symptomatic people are being tested, we have seen an increase in the overall rate of 4.7%. And again, this past week, we saw the highest percentage in 1 week's time, which was 5.8%. A higher percentage of people who are testing positive is why we need to test anyone who has symptoms to impact the transmission. The state is also up to 13.5%, while the national rate has declined to 18.5%. The health department has been working in the unified command structure to lead community preparedness and response planning. As this pandemic has progressed, 2 of the many important resources that we have emphasized in getting more testing done and increasing our contact tracing capacity as needed. We have trained some of our existing nursing staff to help with contact tracing. We have had 8 to 10 staff members working on contact tracing, and now we will have up to 28 to manage the number of new cases we are experiencing. This is to ensure any specific outbreak can be mitigated. We know that there is great anticipation of the possibility of returning to a sense of normalcy and routine activities. However, it should be evident based on recent numbers that it will be a gradual process in easing restrictions as we emerge from this pandemic. We will need to continue to be innovative and find ways to combine public health measures and everyday business practices. No matter when or how local measures are refined, there are things individuals and all types of businesses need to be prepared for. The two things that we can do for sure is to continue being physically distanced, and for now 10 or less in public gatherings. The mayor will be sharing more details about future considerations.
Thank you, Director Lopez. So testing, of course, does continue to be a key in fighting this pandemic, and the increased testing that Director Lopez mentioned that she anticipates becoming available this week is so important. That's because testing capacity is what undergirds our health department's ability to isolate sick individuals, to quarantine their close contacts, and thereby prevent further transmission of this virus. Now that testing capacity is growing in Lincoln, we strongly encourage anyone with symptoms of COVID-19 to get tested right away. We also want to make sure you know that that list of symptoms is growing too. Just yesterday, the Centers for Disease Control and Prevention published a new and expanded list of symptoms consistent with COVID-19. That expanded list of symptoms reported, ranging from mild symptoms to severe illness, now includes the following: fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, repeated muscle pain, headache, sore throat, and a new loss of taste or smell. If you are experiencing any of these symptoms, we encourage you to seek testing. The process is safe and easy and starts with an online risk assessment at chihealth.com or bryanhealth.com. And of course, you can always call the health department for guidance. Just an update on the testing capacity here in Lincoln. A total of 240 people were tested at the drive-through testing sites from Friday through Sunday since we last spoke. Thank you to everyone who participated in this major undertaking. But again, that is only 53% of the total testing capacity that's being utilized at these sites over the last few days. So if you have symptoms of COVID-19, and again, there is an expanded list of symptoms that you can see at the CDC website, please take advantage of this expanded opportunity to get tested and to help our community defeat this virus. At this time, if you have an order from CHI Health, St. Elizabeth, or Bryan Health, or from a doctor, you are permitted to use the drive-through sites. And if you need assistance with that, you can also contact our health department at 402-441-8006. Next, we want to spend some time discussing some of the key indicators that are guiding our local response to COVID-19. Many of you are asking what factors are guiding decision-making about our local directed health measures and how we will know when they can be relaxed. All of us feel the heavy toll that this pandemic is taking, and all of us are eager to get through to the other side of this pandemic and to fashion our recovery. So, what must be considered in order to get there? There are a number of different factors that our health department is taking into account. 5 primary factors include testing capacity, the number of our daily cases, the positivity rate, which is the percentage of people who take the test and are diagnosed as positive for COVID-19, the strength of our local healthcare system, and of course, our local public health capacity to do the case investigations, the contact tracing, as the need demands. So, to start off with testing capacity, we'd spoken about that. Another key metric is the number of cases and the direction in which they are moving. Ideally, we'd like to see a 14-day period with flat or declining numbers of new cases, which would indicate a lower risk associated with loosening some of the more significant restrictions. Another metric that we evaluate is that positivity rate. You've heard Director Lopez discuss the positivity rate at the local, state, and national levels. The positivity rate is the percentage of people who test positive out of the number of people total being tested. And we know that as local testing capacity increases, we will see more positive diagnoses. We've been anticipating that, and of course today's data bears that out. However, the positivity rate provides an even sharper picture of the virus's progression in our community. As our testing ramps up, a decreasing positivity rate would be a welcome indication that we are controlling the spread. With regard to the strength of our healthcare system, We certainly want to feel confident that our healthcare facilities have enough beds, ventilators, and PPE to manage COVID-19 cases and future potential outbreaks. And that's why our Lincoln-Lancaster County Health Department communicates daily with our healthcare system leaders, and together we monitor this status. And of course, we're very proud of the strength of our healthcare system. The fifth indicator that I mentioned earlier was public health capacity. And this indicator has to do with the capacity of our local health department to perform contact tracing at a pace that keeps up with caseload demand. And you heard Director Lopez talk about how they've been ramping up that capacity along with the governor's initiative to also build out teams to deploy statewide. In addition to the indicators I've mentioned, the testing capacity, the number of daily cases, the positivity rate, the strength of our local healthcare system, and our local public healthcare capacity. In addition to these factors, the health department looks closely at some individual factors such as the location of any new cases and the circumstances behind the new cases that emerge through their contact tracing efforts. It's incredibly important to emphasize that until there is a vaccine for COVID-19, we still will need to continue to employ some degree of the social distancing measures to slow the spread of the virus. This is because the risk of future outbreaks will remain. Hotspots could still arise and threaten our progress, causing us to adjust if we need to in order to protect our people and our health care system's capacity. Even when the most aggressive measures are lifted, until there is a vaccine, individuals at high risk for developing severe cases of COVID-19, older adults, people with underlying health conditions such as heart and lung disease or diabetes, most likely will need to continue to stay home. Part of the ongoing strategy for reopening will also be face coverings. Wearing a face covering out in public is going to be key to protecting one another. They are also an important visible reminder to be vigilant in our efforts to prevent the spread of the virus. And best of all, face coverings are a low-cost intervention. And to set the stage for what the coming months look like, we all need to acknowledge that we are in uncharted territory. Any relaxations of the non-pharmaceutical interventions, whether they were ordered in or undertaken voluntarily by our residents and businesses, any relaxations of those measures, such as remote learning for our students, the limitations on public gatherings, teleworking, and more, have to be done carefully. Think of the process not as an on and off switch, but instead like a dimmer switch. We won't be flipping on a switch, but rather we'll be easing off the measures and practices in order to prevent flare-ups that derail our progress on the road to recovery. All of the non-pharmaceutical interventions that our community has undertaken obviously have worked well in Lincoln. They've bought us a lot of time to prepare, and they've prevented our hospitals from becoming overwhelmed. So even as we move forward with relaxations of the measures, we still must continue to think about how we can create barriers between the virus and its next potential victim. One thing that does seem certain amidst the uncertainty that we face, when we get through to the other side of this pandemic and look back at the efforts that we undertook together to create those barriers and defeat this virus, we will be able to point to the accomplishment of our lifetime. Moving on, we're going to talk a little bit about city operations updates. We have a couple of updates from Parks and Rec today. First, we're going to start with the Sunken Gardens. And the good news is that the flowers are starting to bloom, and the garden is on its way to another great display this year. I want to thank all of the volunteers who planted 18,000 tulip bulbs last November. Many of them are in full bloom, with more on the way, and we have a few images, a sneak peek at some of them right now available. And like many city operations, the Sunken Gardens too is adapting and innovating to continue to shine amidst the dark clouds of the pandemic. We have modified the annual Wake Up the Beds event to allow for social distancing. Volunteers who want to help bring the gardens to life by planting annuals this year will be able to sign up for a 2-hour time slot on weekday mornings starting May 11th. The Parks Department expects this work may extend through May 22nd. Some people, of course, have already registered for this event, and Parks and Rec staff will reach out to them to get them scheduled. Anyone interested in volunteering to plant the beds may send their name and address to parks@lincoln.ne.gov. And we recommend that you do so soon because this is a very popular event and slots may run out quickly. To keep everyone safe during the event, Parks and Rec staff will check the temperature of all volunteers upon arrival. Volunteers will be assigned to specific areas of the gardens so that everyone may remain at least 6 feet apart. And volunteers will be asked to wear cloth facial coverings and to bring their own tools. We also want to mention that both the Garden Gab and the Garden Docent programs are on hold until further notice to protect staff and volunteers. Finally today, it's another Sunshine Monday. We are again sharing some of the beautiful art created by Lincoln children as part of the Sunshine Kids for Seniors project. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork. And if your family would like to participate, you may send your scanned notes and artwork to sunshinekids@lincoln.ne.gov. With that, I'd like to open it up for questions.
Mayor, this is Bill Shammer with 1011. You talked about wanting to see a 14-day period of flat or declining cases. Currently, our DHM, I believe, expires in 9 or 10 days. So is that May 6th date likely getting pushed back, considering our cases are still rising right now?
That's a great question, Bill. This has been a rapidly evolving situation from day one, and so we are evaluating on an hour-by-hour basis where things stand and what new steps we ought to be taking. We certainly want to try to get to the other side of this pandemic. The virus, of course, dictates a lot of our movements. The virus drives the bus, and we're doing defensive driving around it. So we will be in conversation about how we can make adjustments and accommodate some of the new guidelines coming out. We don't know for sure what will happen after May 6th in Lancaster County at this time, but it is something that we are working on because we know we want to try and provide guidelines to businesses about how they might make adjustments to their operations if they're able to reopen. And the health department is working around the clock to develop guidelines, and those guidelines are being shared widely. We want to make sure across our state, the different health departments, they're collaborating and talking with one another to develop guidelines that will help protect the safety of all our residents in Nebraska.
Mayor Riley Johnson from the Journal Star.
Hi, Riley.
Hi, Mayor. What has there been any confusion or folks looking to the city and the health department for more guidance with the competing directive regarding houses of worship and under the governor's restrictions and lax restrictions beginning last Friday and the current city DHM?
I would say, first of all, that we have never, through our local DHM, canceled worship. Churches and synagogues and temples and other houses of worship have always been able to operate but within the 10 or fewer person rule. So many of those houses of worship, of course, made the right decision to postpone in-person worship in favor of virtual worship. And we know that requires sacrifice, and people want to get back to a normal way of practicing their religion and their faith. So we will continue to work with our faith community to develop guidelines and to help support what comes next for them. As you heard the governor say, there are still strong recommendations that folks are in high-risk groups do not go back to places of worship in person until there's a vaccine. So we will continue to provide up-to-the-minute guidance as it becomes more clear for our county, and we're working on that right now.
A follow-up question for these directed health measures, who has the final say? Is it the local health director in determining what restrictions are in place, remain in place, or does that power ultimately rest with the governor?
I said earlier today when someone asked me a question like this that the power really resides with the virus, because the virus is really driving that bus and helping to determine how we respond. And I think what's important to remember is that no matter the level of government or the jurisdiction, we all are trying to do our best to protect the health and safety of our residents. And that's why our collaboration and ongoing conversations are so key. What you've seen so far, for example, is that in Lincoln and Lancaster County, Director Lopez issued a directed health measure, the one that it goes through May 6th, and the state went ahead and issued a concurrent one for our county and several others. So there were slight differences between the two, but we've appreciated that those differences have been supported by the governor in the past, and we'll continue to have conversations about whether or not there will be differences in Lancaster County going forward.
Hi, Mayor. This is Erin Grace with the World Herald. Just writing about this for tomorrow. When do you anticipate knowing whether the restrictions will be lifted after May 6th?
Well, I wish I could answer that question. I can't. I don't have an answer for you on that today.
Mayor, this is Bill at 1011 again. Just following up on that, would you know when you'll have guidelines or recommendations for businesses? Will that happen this week sometime?
I'll bring up Lopez to answer that question because her department has been working, around the clock to develop guidance for a number of different industries, working with key stakeholders. I think she could speak to that with greater detail.
Hi, Bill. We're hoping to put out, we've actually worked with over 100 businesses here, getting input and understanding about their operations. And we put together a set of recommendations for these businesses, and we'll be placing them on the Health Department website to get further comment and feedback from those who are providing those services in those areas, and understand what other questions they might have. We have a really collaborative process at the Health Department in all the work that we're doing before this virus came here, and we're going to continue to follow that through as we move forward. We've done a lot of work with child cares. We've been working with some of our restaurants and the Restaurant Association to get information for them, for example, and what kind of guidance would work best, both to keep the workers there safe and to keep the public safe. And that's our goal all the way around. So you'll be seeing that coming up on the website.
Director Lopez, Riley Johnson from the Journal-Star.
Yes, right.
Hi. What more does the health department know about that? Those cases that they were investigating at the Smithfield former Cook Foods site here in Lincoln?
Actually, we had one case at that location, Riley, and they have done an exemplary job at that business. We've had contact with them previously and just learning about what they were doing there. And I know our recent case, the one case, was already dismissed from work. The plant there I would like to really recognize because they have identified early on any workers who might be in a higher risk category or more vulnerable, whatever term, having underlying health conditions, and they have been supporting them while they don't work. They monitor temperatures every day of people coming into the plant. They provide masks for individuals. They're very strict about their quarantine and isolating of individuals. So we anticipate that we will have very positive results there.
And to clarify that one case is one positive, confirmed positive case that's in the 156 reported.
Right. We don't there. We have we've been doing a lot of work with the CREAT, the Public Health Solutions, the health department there, jointly working throughout the weekend on cases that have been identified from the screening that was done there. I mentioned that on Friday, that the National Guard had done testing in CREAT on Thursday, and then Bryan Health had done testing there on Friday morning. We've been getting those results in. So today we're working through that to see how many more cases we have here. And there will be more testing offered in the CREAT area by Bryan this week and probably by the National Guard. And I think you probably heard the Smithfield plant has decided to close there for a period of time.
Abby Peterson with 1011 News here. A risk management organization recommends pools stay closed for the summer. Has the city made any decisions on whether or when or if at all pools will be opening this summer?
I think we are in discussions about that and talking with Parks and Rec about what would be safe. And we're not at that point where we can make that decision yet at this point, if it might be just a later date for opening. And once again, as the mayor said, you know, it's a lot about the virus, and right now we're seeing that uptick for us. So we'll be able to make better decisions in a few weeks.
Director Lopez, does the sort of relaxing DHM in Douglas County or Sarpy County provide any data points that your staff will be looking at to see, what happens when those restrictions on public gatherings are relaxed and kind of guiding your DHM decisions?
Well, we've learned all along from what's happened in our state and across the country. And we seem to have been about 2 weeks behind Douglas County throughout this process. So yes, we'll definitely be watching. We won't have maybe that same length of time to see what's happening. But as you know, every day with this virus is a new day. We learn more. Yeah, and one of the things is that we've been sharing information with the governor's office and developing some of the guidance for restaurants and other, like the hair salons and barbers and that. So we've been sharing that information with them. We worked with Douglas County and the Department of Ag on the restaurant guidelines as well.
This is Bill at 1011 again. I know you guys, it's so hard to put a timeline on things right now, and I totally get that. But do people need to prepare at least for the possibility that that May 6th deadline gets extended?
You know, I think that's a fair statement to say that, but I'm not saying that's what's going to happen, Bill. But what we're trying to do too is also, we've heard from our businesses in the community that they need to know what might that look like and how can they do things safely. So that's what we're focusing on now, because we will make changes and we will open things up. And how we do that needs to be a collaborative process, but we also need to provide that guidance to the community about what's the safest way to do that. So that's why we're putting information out now, so that we know our businesses can provide feedback and also begin to prepare how that might look for them.
Pat?
Yeah.
Questions from Andrew at Channel 7 about corrections and the role the city has in terms of the folks who are incarcerated.
Corrections, the State Penitentiary and Diagnostics and Evaluation Center are state-run facilities. We work with those, the individuals who might be workers that reside in our community. We provide guidance if the corrections department needs testing supplies or other things. We're always a resource to them. But the state really is in charge. It's their jurisdiction to run corrections. I think sometimes people don't realize that at corrections, for example, at the Diagnostic and Evaluation Center, they have a physician, they have nurse practitioners, they have nurses who work there. All the individuals that come in, the workers, which is the primary concern, which is the same in any of our congregate living or nursing homes, is the people coming in. Every day, people are temperature monitored. All the staff wear masks, have hand washing available. All of the inmates that are there also wear masks. They have isolation and quarantine units there. They follow all the CDC guidelines for corrections facilities. And Director Frakes, actually on the state website, you can go there and see the Department of Corrections frequently asked questions available to you if you want some more detailed information. Thank you.
Director Lopez, before you leave, one quick follow-up. This is Bill with 1011 again. What details do you have on Smithfield deciding to close in Saline County? Do you know how long that's for?
Bill, I would be misspeaking because I can't, it just happened so fast. This decision was just made in the last few hours, or maybe even the last 2 hours. So hopefully it's okay that I brought it up. So I think you'll be hearing more.
Are there any other questions before we wrap? All right. Thank you so much for tuning in. We'll be back tomorrow with the latest update on COVID-19 and our community's response. Thank you so much for tuning in.